existential excellence in counseling and psychotherapy. Metapsychiatry brings to the field of human health and human problem solving an existential perspective of a context, a larger context in which to view human problems, and thus the larger context we see to be the realm within which any real healing of human problems comes about. And so we're offering, we're growing in our endeavor to share with the professional world ways of understanding human issues and human problems, and allowing these things to be illuminated by the light of truth. Metapsychiatry is a scientific discipline of education and healing based on a metaphysical understanding of man and of reality. We understand God to be omniactive love intelligence, a principle of omniactive love intelligence, and man to be a spiritual being, a consciousness through which omniactive love intelligence manifests itself. And that is the context of our understanding that we bring to bear on specific issues. And that is thus the focus of our whole training program for professionals, is we are truth-oriented rather than problem-oriented or phenomenon-oriented. Dr. Hora has used the example of a tree and the leaves of the tree. We understand that man cannot be studied and understood apart from understanding God, any more than you can study and understand and heal a leaf apart from the tree. To take a single leaf, try to understand what it is, try to understand what would heal its blight or whatever the problem it has, without understanding that a leaf is the manifestation of a whole tree, would be futile. And so we find that many human self-help endeavors, despite their high aspiration to healing, are unable to heal because they do not see and understand man in the context of spiritual reality, in the context of God. Now, Dr. Hora has commented that we don't treat symptoms or diseases, and we don't treat people. We treat modes of being in the world. Another way of saying this, perhaps, for those of you who are new to the perspective, would be that the metapsychiatric counselor or practitioner understands himself to be a place where truth treats ignorance. Truth treats ignorance. Now, actually, how does truth treat ignorance? What would that mean? Some of you who are familiar with the perspective. How does truth treat ignorance? Does anybody have an idea? By seeing is as ignorant, right? And then what?
Shed light. Darkness seems to be.
It sheds light, and what happens when light is shed?
There goes darkness.
Right. The same thing that happens to darkness when light is shed. The darkness is revealed in its nothingness, and therefore you could say dissolve, but it doesn't even really dissolve. It's just seen to be nothing. That's our approach to human symptoms. Symptoms are phenomena. That is, they are pictures or appearances of thought, of ignorant thought. And when truth shines, when the light of truth is shed upon the ignorance, the thoughts that are manifesting in forms, something happens to the form, to the manifestation, when they are revealed to do nothing. Now, this is contrasted with the ordinary approach on really across the board on the human level of approaching symptoms from an operational perspective. Here is a thing that we will try to figure out. We'll see what's wrong, diagnose it, and then we'll see what to do about it, how to make it go away or change it or fix it. And the trouble with the operational approach to anything is that it confirms that which it's attempting to operate on. It gives it substance, power, reality, force. So our attempt is, it may be very well intentioned, but it ends up actually doing the opposite of what it intends, and actually confirming and reinforcing the problem or the symptom rather than allowing the conditions which can allow it to heal or pass. Now the topic, I'd like to approach today's topic actually in light of a text that I used last weekend in a paper at our conference, in which Jesus is speaking to his followers, or Dr. Hora has said his research and so forth. He has meant to send out a number of his apostles, we might say, to heal and to preach. And they came back full of rejoicing and said, "Our Lord, even the demons have submitted to us in your name." And he says, "Behold, I give you power to tread on snakes and scorpions, and over all the power of the enemy. Nothing shall harm you. But do not rejoice in this, that the demons submit to you, but rejoice that your names are written in heaven." And we looked at that last week as an individual issue, but I thought during this week it's actually wonderful a word of teaching to counselors, because counselors ordinarily our understanding of what we're about is we're trying to have power over demons, the demons of human relationships, the demons of the human mind or psyche, all these fearsome appearances. And Elizabeth is going to talk in a few minutes about the ordinary professional perspective on suicide. Very revealing. The concern is always, boy, here's this demon. How do we get power over it? Jesus said, yes, you have power. You have power. I give you power. But that's not the issue. Don't get interested in, hooked on that issue. The issue is spiritual identity. Your names are written in heaven. Keep your attention on that. And we're going to try to take Jesus' injunction and apply it today to a big demon, suicide. Now, in our culture today, this is a big demon, and there's lots written about it. All kinds of articles and stuff on television about who's doing it, and how old they are, and how big they are, and where they are, and why they're doing it, how they're doing it. And there are all kinds of groups marshaling themselves in our culture out of the best intention to try to get power over this demon. Many of you have at one point or another worked in telephone crisis intervention centers which focus on training you to deal with suicidal calls. Professional counselors are taught about this and deal with this phenomenon all the time. So we're going to try to take Jesus' injunction and words of wisdom and apply them as we look at this demon. Now, in metapsychiatry, we have a very useful and simple tool which we bring to bear whenever we approach, either individually or professionally, any of the phenomena of life. And that is the two intelligent questions. We bring to our consideration, we approach it in that context, two intelligent questions. The two intelligent questions are, what is the meaning of what seems to be, and what is what really is? The meaning of a phenomenon is the mental equivalent. It's the thought or belief that is being manifested or pictured forth in the phenomenon. And so if we apply these to the issue of suicide and we ask, what is the meaning of this phenomenon? We find something very interesting in terms of this text that we introduce. We find that the meaning of suicidal ideation has to do with a concern with power. Power. You see, that actually the phenomenon of suicide is a manifestation of the self-destructive nature, the essentially self-destructive nature of the self's concern to have power, to have personal power. And it reveals that this concern ends up destroying itself. It leads down a path where the final conclusion, the desire to insist that one is a self and that self has personal power, can only lead to the power turning against the self. You see, the power is a self issue at heart, and it's based on the self's misperception of being separate and isolated and powerless. And therefore it must constantly, it's intolerable to be separate, isolated, and powerless. And so the self is constantly trying to prove that it can make it happen. How many mottos have all of us seen over the past few years in various religious and non-religious groups that assert in one way or another, we can make it happen, folks. We can run our lives, we can make things happen. Well, when the self comes to the point and it discovers that it absolutely cannot make one's life happen according to the dictates of the self, that's an existential crisis. And at that point, there are some options, one of which is to learn something. But if that option is not received, then another option is to insist one step further and say, well, I can make one thing happen. By George, I can kill myself. That is, I can end this thing. Or often, the other dimension of suicidal ideation is I can by this means force others to give me what I'm seeking. All of us who have worked with this issue are aware of the extraordinary manipulative dimension of it. So there's a power issue. And it's an existential issue. Because one of the things that we all need to learn in life is that there is no power, no personal power. There is no power in selfhood. We are places where omni-active love intelligence manifests itself. And whatever power there is God's power. It's the power of reality. And so the recognition that there is no personal power does not have to be a bad recognition, but if it's to be a recognition which leads to reformation, to regret and reformation, then it needs to happen in the context of understanding life in existential terms, where we are able to let go of the issue of personal power in response to seeing omni-active love intelligence as the real power, as the power of good, of life, of health in reality. So in metapsychiatry, we also have a principle, if you know what, you know how. And we can see that with regard to this issue of suicide, as with regard to any other phenomenon, the place to begin, the most important thing, is to start with understanding clearly what it is, what the issue is, what the existential issue is. And that clarification unfolds to a healing possibility. I'm going to stop now for a moment and ask Elizabeth to share with us. Elizabeth, this is Elizabeth Butner, and she works in an Orange County mental health clinic where her job is outpatient therapist, psychotherapist. And so I asked Elizabeth to share with us the kind of thinking that she has been taught and that she works in with regard to issues of suicidal patients.
Thank you. It was interesting in getting these ideas together. I read a lot of articles and did a lot of books and talked with some of my fellow therapists and got more and more confused and ended up with about 3 pages of notes which I had planned to bore you with. But as I looked over the ideas and as it kind of percolated in the back of my mind, what came clear to me was that all of it could be very simply reduced to different areas. And that was the one area is that the therapist needs to facilitate some kind of support for this person who is at this point of wanting to kill himself. And so it's an interpersonal supportive idea. And it can be by the therapist showing empathy, being there when the client needs him, by getting a significant others in the family involved, or the minister, or the police, or the hospital if it gets to that point. The community resources and that sort of thing. And the other area was that the person apparently needs to have new behavioral alternatives. He needs to learn how to cope. And there was most of the things that I had written down, the first part came from an article written by some people that worked at the Los Angeles Suicide Prevention Center, and it was kind of a set of guidelines for the people who are handling phone call type things. And the other one was an article in the Social Work magazine about a new theory in crisis work. And the basic idea there was that a person faces a crisis when his previous coping mechanisms have failed him. When he faced a new situation for which he had no way of coping, and everything fails him and he becomes suicidal as a result. And that their idea is that if you can share that with the individual and say to him, the reason that you're feeling this bad is because you don't know how to cope with this, and you've always been able to cope with everything else that's come up, and now you're stuck. But this in itself relieved a lot of their anxiety. And then the rest of the therapy is in you helping them to discover new ways of coping. So it just appeared to me how operational the whole idea is. And several of the people that I worked with gave me their ideas. One said that people do not commit suicide because of depression, but because they consider themselves isolated. And this sense of isolation must be broken down with therapist help. Which is really just another aspect of support and coping. And another said, pointed out, I thought, a valid point that when a person is suicidal, it's good to find out if this is a secondary thing to a psychosis or perhaps to drug or alcohol abuse and treat that, which seems logical. And that suicide is a control issue rather than understanding it as a power issue. And that we need to let the patient know that we do not assume that we can control his behavior. So that was really basically what I came up with.
You're explaining that suicide is a control issue rather than a power issue.
Well, it seems that the idea is that the client feels I'm not definitely sure how that's different. Yeah. Somehow it seems to be different when she talks about it, but
It's another look.
yeah.
If the problem is with the capital, that is called control.
Uh-huh.
If the power problem is with patient that is going on.
I the patient is doing what the therapist is going to try to control him. Right.
No, that's, if you are power oriented and you say, we want to have it power over your destiny, then you want to exercise power in the direction of yourself. So that's a power problem. Now the therapist says, I'm going to have power over this patient. You don't say that. You say, I'm going to control this problem.
Yeah.
Right? It's another power So we are approaching the issue of power madness without
Right. Yeah.
it is compounding the problem.
Is it all right if I ask him a question?
Yeah, I also have made an observation about the fines that the therapist gets into, and that's those of you because of the way the problem is identified. The minute somebody, most of you, any of you who has the experience as a professional or just as a family member, with somebody who starts talking about suicide, know that you are immediately in the grip, hypnotized by the power issue. They're going to do this terrible thing, and I have to do something about it. If I don't do the right thing, if I say the wrong thing, I do the wrong thing, I am to blame. False responsibility, but you see that the symptom then immediately controls the whole situation. And anything the therapist does in that in the context of being controlled by the symptom is not going to yield healing. So the Elizabeth had mentioned that there are very prescribed guidelines that they are given. If certain words are mentioned, you must do this, do that, and do the other, or else you are liable. So you can see how all of that feed compounds the issue of power and gives the patient the sense of having power to rally. People are running around making all kinds of things happen. Yeah, there's a kind of...
Makes it power corrupts, right? And if you confound it, then there is an absolute corruption, exaggeration of the idea. It's interesting that when the issue of suicide is mentioned, immediately two thoughts occur. How should I do it? Or how should I not do it? Yes? So don't expect us to tell you how to commit suicide. But neither expect us to tell you how to prevent committing suicide, how not to do it. The question is not how to do it or how not to do it. The question is, what is it? And when we will know what it is, then we will know how to be helpful. We're not going to help anybody. We're not going to control anybody. But we will know how to be helpful in situations. Now, what's the difference? What is the What's the difference between helping and being helpful? Yes, that's it.
I think Anne said it very well when she says that we are slaves where truth revealed itself. And I once heard a very wise psychiatrist say that our attitude as therapists needs to be one of letting, that a person has a right to be sick. That attitude of allowing the person to be. So an attitude of helpfulness is, I'm not the helper. I'm a place where help, God, love, intelligence comes true if I let it come.
Right. Now, being helpful is an existential position. Helping is an operational position. And in order to operate, you need power, which you ain't got. Okay. Okay.
I think it's along the same line, that question. I noticed that clients that I've worked with that are suicidal usually have an annihilating mode of being. And I'm wondering if that's the other side of the coin of them thinking or having ideas about annihilating themselves. Is that with the same power and control struggle?
I've heard in cases of people who use alcohol or drugs that they're referred to as dying by the inches. In other words, that it's a slow form of suicide. Is this also actually a power issue then? That they have all these people rallying around trying to salvage them?
Now, we have in metapsychiatry a better name for power madness, and that is self-confirmatory ideation. What makes it a better name? What makes it better to say self-confirmatory ideation rather than power madness? Yes, Patrick?
Well, it seems like that makes a big issue out of it, because most all these valid ideas are self-confirmatory, and if you say something like power madness, which would especially apply to suicide, you'd be separating it, making it something very special or more power energy. Or it seems that the self-confirmatory ideation is a universal term for invalid ideas.
That's correct. Yes, Patrick. Thank you. We also say that self-confirmation is self-destruction, and self-destruction is self-confirmation. It is interesting that Sartre that man has only one freedom. He can kill himself. Now that's a strange way to think of freedom, isn't it? Is it freedom to kill oneself? Is it an assertion of freedom? Yeah?
Yes, I would answer that, yeah.
And what we're killing is a sense of separation.
If you commit suicide, you are killing the sense of separation.
Yeah. You're losing, oh, okay, the issue is suicide.
Right. You know, you're not solving it. You just say, you just annihilate an illusion of freedom. What is real freedom? You see, we cannot be free any other way than the way Jesus pointed out. That's the only way to reach freedom. How did Jesus define freedom? Knowing the truth. That's the only door to freedom. Nothing else. Freedom is the full realization of our complete contingency on God. When Jesus said, of mine own self I can do nothing, he asserted its complete freedom. When it's suicide, it's just the opposite. I can do something, right? That's a delusion. Now, what practical value does it have for us to theorize and define freedom? If we are ourselves deluded about power and control and self-assertion, ego strength, and operationalism, then we are not really being helpful. We are just compounding the problems, whether it's the issue of suicide or that anything else. Now, this may sound very strange to people who are trained in the operational approach to all problems, mental, emotional, physical. It's a very strange, and it may sound like we are passive and quiet, distinct, and do nothing and helpless. But in fact, we are able to bring to bear the only power that really exists, namely the truth of being. And that's the only power, and that is an infinite power. And we call it love intelligence. So if we are to be effective in being helpful with any kind of problem, the first thing is that we must gain our own freedom to the process of knowing the truth. Yes, coming back to Anne's quotation from the Bible about Jesus sending out his research associates into the world and giving them power to overcome demons and serpents and scorpions. In other words, all the human psychological problems yielded dramatically to them when they went out and established themselves in private practice. They became very effective therapists. They actually were tremendously effective in their work. And they were elated and started being proud that they have this power over demons and pathology. Now Jesus said, well, this is nice, but don't delude yourself. That's not the main important thing in life. To be a good therapist and have a successful practice, this is not the main issue of life. The real issue of life is individual redemption. When Jesus said, rejoice that your names are written in heaven. He may most likely have meant. The issue is individual redemption. And if you see that you are being effective in healing others, be grateful. But look at it this way. This is just the beginning. We have to be much more than just effective psychotherapy or healers. The real issue of life, both for therapist and patient, is individual redemption. That's probably what that quotation refers to. Yeah.
Dr. Hora, what is redemption?
Redemption is reaching a realization of the truth of being. When you understand who you are, what you are, where you are, and what your purpose is in life, then you reach a stage of realization which we call in the Christian tradition as redemption. in the Buddhist tradition is called enlightenment or awakening, or samadhi in India, and the other name for redemption. The therapist must concern himself with his own redemption and with the redemption of others who are willing and interested in going on that path. It's not enough just to remove problems, solve problems, or relieve suffering. This is just a temporary measure, or it is just a way of awakening people to the possibilities of redemption. Of course, if a therapist is not redeemed himself, its effectiveness will fade out gradually. It will be less and less effective. Because he will be distancing himself from God and slowly become proud of his power to control people and to control people's problems. And I think that's happening quite often. You know, you can slip into pride and self-satisfaction if you don't keep in mind the ultimate objective which Jesus has outlined in this verse. Your names are written in heaven.
It occurred to me, Elizabeth and I were discussing before we started, noticing that the constant tendency and temptation to get seduced or provoked or intimidated by the symptom in our work and interested in the symptom rather than responding to each symptom as an opportunity to turn and look in the direction of the truth of being. As it occurs to me that our work is either redemptive for us as well as our clients if the direction of our looking in our sessions as well as in our everyday life is in the direction of truth rather than in the direction of the client symptom, or it's non-redemptive. And all the burnout that you hear, professional burnout, all the trouble that mental health professionals deal with has to do with sitting there and looking all the time at the symptoms, and they get you. But it can be a very redemptive work if every phenomenon is simply another opportunity to look in the direction of the truth, to shed light, as Dr. Hora said. And it also occurs to me that the nature of one's practice is completely determined by the direction of looking. If our clients pick up that we are very interested in symptoms, we will attract people who are interested in being sick and having symptoms. If clients become aware from the minutes they meet with us that we are interested in truth, then we will attract people who come, whether they're consciously aware of it or not, to find truth. We might open up now for the last 15 minutes. We'll have questions from the floor of a general nature, and then after our break, we'll get into a case discussion. Bill?
I have a question, Ann, in light of your last statement. Every time we have a situation like that, it's an opportunity to shed light. And the question comes from the idea that still can be perceived as an operational thing. It's my job to shed light on this person. And I think that's an easy trap to fall into. And then you start measuring how much light have I shed. And
I understand that I might be.
then you start gauging your number of suicide attempts accordingly,
Yes, certainly that's the pitfall. Looking at you sitting over there, Larry, though, Larry is shedding light right now, right? Why is he shedding light? Because he's sitting in it. That's right, because he's sitting in the sunlight. The direction of our looking, we get the idea that we have to know a lot or understand a lot, but it's the only thing that matters is that we are looking in the direction of light. Light takes care of its own shedding. Thank you very much. That's what it is. But if we have to be interested in the light before it can shed through us.
Let us just return to the issue of operationalism, the process of shedding light. Now, let's not confuse the issue of shedding light with giving people interpretations. The traditional way of shedding light is to give patients pre-digested interpretations handed down to us through the various schools of psychotherapy. It is not shedding light, it's shedding darkness. As we read in Job, who is it that counsels darkness with words without knowledge?
Even in the spiritual interpretation.
Right. Now, the peculiarity of the metapsychiatry work that the light we are shedding, we are not shedding it. In the course of confronting certain problems and seeking to discern the meaning of these problems, we are inspired with certain aspects of the truth, which then correct the erroneous ideas which have resulted in those problems. Now, the metapsychiatry therapist doesn't do the shedding of light. He is a medium through whom this light will shine. So, while looking at it from a third-party position, it may appear like shedding light, light is being shed in an operational way. It is not really operational. It is a spontaneous flow of the right idea, reaching the receptive consciousness of the therapy to a process called inspiration.
Carol.
My question is related to that. I think of the operational thinking in terms of how would you describe the therapeutic process? There's a tendency in my own thinking to look up for this operational approach. How does one posture himself or shed the light with the client? What I think is more of a matter of reflecting.
Well, the word reflecting is often used, but it's not really a very helpful word, because in order for the reflection to take place, there has to be a subject and an object. It's a subject which expresses an idea and it is reflected back. So we prefer to talk about inspired wisdom flowing through the consciousness of the therapist. And the glorious thing about it is that in the process of shedding light or responding to the patient's spiritual need, we ourselves are blessed. And we are not getting tired. It's not an exhausting work. It is an inspiring work. Doubly rewarding. Yet,
That the process of therapy is just being quietly receptive to what
what reveals itself, right? And then responding on the basis of inspired wisdom. It's a beautiful process which blesses both therapists and the patient.
actually anyone who has himself been in the process of existential counseling, all that's required really is that you observe how the healing has come in your own life. It's an existential realization, and that's part of why we stress in the professional training program that one who has it been involved in the healing dialogue with an existential counselor, because you discover that whatever is healing is a revelation, and that you don't have any sense that, especially if you've had other kinds of counseling where it was clear the therapist was doing certain things to you or for you, you just discover that what is really healing is something, an event in consciousness that is somehow shared with the therapist. And then the question of how would I do this doesn't even arise, because it's clear that it isn't done.
Where you said that we must respond to the client's spiritual needs. Can you talk about that process a little bit? Focusing our attention on their lack of knowledge or misdirected ideas or lack of understanding of their spirituality?
Well, of course, we must be careful with the phrase spirituality, because it may cover a multitude of confusion, right? But in fact, all human problems are manifestations of inadequate understanding of existence as a spiritual fact. And if our patients manifest certain problems in life, invariably the issue boils down to the fact that they misperceive their own lives and lives of others in terms of organismic and material processes. And when we apply the method of the two intelligent questions, we ask someone presents a problem, so we say, what is the meaning of what seems to be? And if we have learned how to discern meanings, which is a special aspect of the creative process which Anne is speaking about, then the meaning of the problem will reveal itself to us as any particular misperception of reality in terms of the material world, so-called, or the phenomenal world. Once we have understood the meaning of the problem, then the corrective spiritual truth flows into consciousness immediately, and we can communicate this with the patient, and he sees his situation from another perspective. And that new perspective will heal the problem.
I wonder how many of you this morning, as we met together and we started out by clarifying something of the truth, the meaning of the suicidal concern in the context of ourselves and spiritual being, uncovering something. And then Elizabeth presented some ideas that are ideas held in the material interpersonal view. Did you not, in your own in your own experience this morning, see what she said differently, hear it differently, understand it because of the context of truth in consciousness that had already been established. Anytime this has happened to you individually, I mean, this is a discovery that all of us make over and over again individually, is that you start with the truth, and then something from the world of the phenomenal world with all of its assumptions comes in. You see it differently. You can't possibly see it the same way you would see it if you start from the world, from the context of assuming yourself to be a person and material and all. Nothing and nobody has done that. It happens because the truth is established in consciousness, and the truth sees it in a different way, which reveals the inadequacy or the mistaken aspect.
You may have noticed what happened between Elizabeth and myself while she was speaking. She was speaking about the power, madness of the patient, and the necessity to control him. Now, how many of you picked it up right away that to control is also a form of power? Right. There were a few of you. And you are already trained in metapsychiatry ways of seeing things. So, if we sit with a patient will invariably say something which is invalid and not realized. The Elizabeth is an advanced student of metapsychiatry and a research associate. He also didn't realize, because it is very easy to be hypnotized by the consensus. The consensus thinking in psychotherapy, mental health communities is that the therapist has to know how to control the patient or his problems. Control is a very accepted trait, right? After all, that's what you as therapist. You have to be able to control people and their problems. Yeah? So we can accept invalid ideas without realizing it. And then these invalid ideas are present in our consciousness and express themselves in action, alter our perception, and we get involved in insanity. We see and that Jesus spoke about his condition, as the blind leading the blind. And what happens then?
It's a man.
Before you go on the break, I would like to say we want to use every minute of the seminar, so we will not have a going away break, just stretching a few minutes, and then we start it on the second part.
Stretching break.